Friends, have you or your kids ever had issues breathing through the nose? And you've been wondering, do I need to see an ENT? What's going on? Then this is the episode for you. We have an incredible guest who I cannot wait to introduce, who's going to take us through a variety of different non-surgical ways that you can address nasal breathing. Welcome back, everybody, to another episode of Your Mouth Matters. I'm here with my incredible co-host, Dr. Taylor, and we have a special guest, Dr. Jill Ghormley. Welcome, naturopathic doctor from Issaquah.
Thank you. Thank you for having me. I'm very excited to be here and certainly love working with Dr. Rebecca Taylor because of all the holistic stuff that she does. And today I'm truly honored to talk about what I do, which, as Dr. Taylor affectionately calls it, a well-intended punch in the face, is what I usually do. But what we're actually going to be talking about today is called neurocranial restructuring and/or nasal-specific technique. They're two different techniques, but they're really involved in musculofacial work. My background came into play with this because of being born deaf and struggling with speech impediment, struggling with just anomalies, airway structure. I didn't learn about this until much later, but as a result of that, it led me down this path of really understanding musculofacial work, dental work, and I love working in the area when it involved speech, jaw, airway, swallow. All of that plays a role in what I do. And in today's episode, we're definitely going to dive deep, like how these two separate techniques, while they're similar in the way they're described, they're actually very different.
Yeah, and I met Jill many years ago. I think we had Indian food. She contacted me. She was like, hey, to know you, because you're doing some cool stuff with the Airway, and I do some cool stuff with the Airway. So we met for dinner, and it was, every time that I talk to Jill, I'm just in awe. I always learn something. She's always like doing a really amazing thing. Like last time we met, you were like, I'm headed to, I think it was Santa
Nepal.
Barbara. And you're like, I'm going to be speaking at this convention. And I was talking to you about my daughter and the nutrition. And you were like, you should try doing this because this. And then you told me that refrigeration was bad. And I was like, oh my gosh, what? It was like every time I talk to Jill, she just has something exciting to say. And I think it's amazing that you were born deaf.
Yeah.
I mean, and the crazy thing is, and people can't see us right now,
Right.
but Jill is just reading my lips right now and can just have a conversation. You would never really know. It's amazing.
Lots of speech impediment, lots of speech therapy. And it came from my mom. I mean, she was a stay-at-home mom. My dad was in the military. So they didn't know what to do with all the traveling and moving. And if you come from a military family, there's not a lot of support. So my mom made sure that I learned how to speak, and that was important to her. And in that process, I thought about fast forwarding what other families have gone through. I was very fortunate, and not very many families have that kind of early intervention. And that's my passion even today. It's really helping families figure out what do you need to do in that early intervention. And then outside the box in naturopathic medicine, because people say, but you should be focusing on that. And I'm like, no, naturopathic medicine is about finding the cause, which means investigation. The more you investigate, the more you research, then you put it all together. And that's how you find balance in general.
Yeah. And I think you and I feel very passionately about preventative medicine and really finding that root cause. And you've had, you work with a lot of babies. You have worked with a lot of babies. You work with a lot of pregnant women, right?
I do.
Getting them ready for birth. And a lot of babies that have issues with breastfeeding, or they have gut issues, gas, colic, all of that. And you might be more passionate in that than the nose thing that we're going to talk more about. But
I don't know. It's fun to do a well-loved intended punch in the face for many different reasons. And we actually do it on younger children for better outcome because it actually impacts primitive reflex. And we're finding with neurocranial restructuring, which was actually invented by Dr. Dean Howell, who is a naturopath. He started in 1995 with it, and he had traveled extensively up and down the country trying to teach as many practitioners in this technique. Because a lot of people think it's just up here. It's actually a whole structural component. And the beauty about this technique, it developed, it's grown over time. It's not just one particular entity, which we call the endoneural ballooning. It has to do with the cranial rhythm. It has to do with cerebrospinal fluid movement. It has to do with neurological development in general. And as a result, it made sense to me to start with babies and work them all the way through adulthood. So I have that wide breadth, but definitely starting with babies so we can educate the next generation.
Mm-hmm.
Yeah.
And I think, nasal breathing is one of those things that's just important, like across the board.
Yeah.
It's actually as if you're a baby and you cannot nasal breathe, it's not likely that you're going to turn into an adult that can nasal breathe. And dentally, we're worried about that because of the facial growth and development. We're worried about the teeth coming in and being crowded. We're also worried more systemically with the nitric oxide production and the heart health, the blood pressure issues. Nasal breathing is really, really important because that's how we are made to breathe. And so when we compensate and we can't breathe through our nose, and this happens with babies too, is that they shift to be mouth breathers. And when you're breathing through your mouth, you're not humidifying the air that's coming in. You're not cleaning the air. That can cause more inflammation in the tonsils and make the breathing issue even worse. And then it also can cause the face to grow deformed. It can make a face that's long. It can make the palate more collapsed, and so teeth come in crooked. And it can cause a protruded jaw when that mouth is hanging open like that. So it actually, the way that you breathe, and especially when you're a baby, actually changes the way that your face grows. And if that nasal breathing isn't happening and the palate collapses, then that can actually change the bony structure inside of the nose, right? And so I love that what you do, because you deal with a lot of that bony structure, right? And trying to fix that. And so many people, I do rhinometry where I'm measuring the volume of the nasal passages. And a lot of times I see constriction, even though people think that they nasal breathe okay. But the thing is that they've always been constricted, right? And so they don't actually know what a nice open nose feels like.
Right.
And so when they do the rhinometry and I say, oh, wow, this is pretty constricted, we have to rule out whether it's a soft tissue issue. Is it inflammation in the nose? Or is it hard tissue? And if it's hard tissue, really our only option has been go see the ENT, get your turbinate reduction surgery. They're going to put their drill up there and wiggle it around. And hopefully when you're done and healed, it feels better. And for some patients, it does. They feel a lot better. They can nasal breathe better. It's really life-changing for them. But for other people, they have that surgery done and it just doesn't really do much for them. And so I love that you offer a alternative to surgery. And I have had it done. When I met Jill, I always like to do the things that I recommend to my patients. And so I've never really had issues nasal breathing, but she was like, that right side is just a little bit more constricted than the left side. And you better, and which is funny because I'm also genetically missing a tooth on that right side. I was like, well, of course, that's my problem side. So I let her do the balloon on me, and it was quite an experience. It really does feel like you're just getting like, bam, punch in the face, but it's over in a second. Like it's like the fastest punch in the face, but then it doesn't hurt after that at all. It's just like so much pressure, bam, and you hear this like cracking. I think I let her do it 3 times to me, and then I was like, all right, Jill, I love you. I'm so glad I did this. I think I'm done. But for patients that have really bad nasal, they have really bigger issues with nasal breathing, I mean, some patients just swear by this technique.
They do.
Can you talk? Can you tell us about like how the history of it and what it is? And obviously, being punched in the face doesn't sound fun. But if you're comparing that to surgery, where this may or may not help you, and there's a long recovery time. I mean, This just feels like you're getting punched in the face for just a second. It's just.
Yeah, punch in the face or drill up the nose. I mean, really, when you think about it like that, it's like, I guess I'll take the punch in the face versus the drill up the nose. Yeah, take us through, as Dr. T was saying, give us some background on it, and then.
So when this technique originally started, it was called nasal, actually binaural ballooning. And what started with was the concept of changing the structure, starting with the sphenoid, but working with the turbinate and the vomer and the nasal septum, and then getting the palate down just to change. But then when Dr. Dean Howell started this process after medical school, he started looking at aligning the body. So more, if you think of it as proprioception, and then movement based on kind of like factory setting, what you were originally born with. And this is where primitive reflex comes into play. We have a construct of neurological things that have to occur in the first year of life. And when they don't, they become retained primitive reflexes. And what we discovered, it's again, going back from a dentistry standpoint, the cranial bone and the palate aren't forming because the tongue is anchored in. And then we start talking about tissue tightness, fascia, frenulum, tongue tie, lip tie, and people are like, it's a fad. Actually, it's not a fad. It's just over a period of time based on environmental factors, based on genetic changes, we are starting to see the changes in our tissue. And we're having this big leap that we're dealing with to undo all of that. That comes with ADHD, that comes with MTHFR mutation, which has to do with methylation. People are asking me, but that's all genetic. I said, yeah, it's environmental as well as genetic. When we look at how our environment is changing, the toxins that are building up, the earth being hotter, that's changing our genetic makeup. So just to put it in a nutshell, why this technique came into play is because the foundation of our being is our brain. So how do we get the brain to do what it needs to do? We have to look at the structural component. So once we start looking at the structural component, we're feeding that information back. Adding, what Dr. Taylor doesn't know is I do a lot of what we call nasal swabbing. So what I'm looking for is what pathology. So you talk about soft tissue.
Mm-hmm.
I'm looking at what pathology is impacting the inflammation of that soft tissue. So it could be something like an endotoxin called malcon. It can be all of the gram-positive, gram-negative bacteria and anything else that's just sitting up there that causes allergies, that causes inflammation. And we're doing this technique. So I add that on because I want to see if there is a tissue problem, there's also a structural problem. Surgery cannot take away malcon.
Right.
Antibiotics can't take away malcon. So I've come up with a nasal solution. Actually, a group of us have come up with a nasal solution to help people with that so that it doesn't impact their digestion. I'm one of the only people that actually do the neurocranial restructuring, moving the bone so that there's better drainage. So when this whole process started, it was about aligning the body. Now, for me, it's, okay, how do I create a maximum air to get those buggies out, if you will? I have to open the sinuses. So if I'm going to open the sinuses, I don't want to do it surgically. I want to be able to give people the freedom to be able to have this done and not worry about surgery, but we have to create a drainage point. And this process can take up to 2 years because that's how sticky malcon is. It literally lives in your sinus cavity. So you can do all the neurocranial releases, you can do all the nasal specific techniques, but you have to create an airway in order for that to happen. And the only way you do that is figuring out what is actually in the sinus cavity.
Wow. So you're actually like swabbing and you're like basically sending that off to a lab.
Yeah.
And then they're telling you what's there.
Yeah.
And then based on what you see, you're then recommending certain, you can tell if it's like, oh, this is probably from a dairy allergy or a food allergy. Yeah. Wow, that's amazing. And
Yeah.
or if it's an infection or if
Yeah.
it's mold exposure or
Right.
wow, that is really cool. Because yeah, I mean the recommendation now is just do some saline rinses or some neti flow and
They're good for the antimicrobial and fungal, but
Yeah.
they're not good for the Marcon.
right.
Marcon just hangs out there.
Yeah, Marcons are just like
Yeah.
superpower.
Yeah.
Yeah.
It's like glue
Yeah.
in there or gum.
How often do you see Marcons?
A lot.
A lot.
Pretty much every patient that comes in with tinnitus, so that's
Wow.
ringing of the ears, pressure across the forehead, and they feel like they have brain fog all the time. They're always fatigued. They're taking all of these supplements. They're still having digestive issues. And that's the first place. I mean, that's the first signal for me. It's like I look at the eyes, if there's any grain under the eyes, or if they're squinting their eyes or reducing them, grinding their teeth. That's usually the first thing I see with Marcon.
So how does one get Marcons? Is this just like from
A lot.
colds that goes around, or where do you get Marcons, and why doesn't the body get rid of them?
And what are Marcons?
It's
Bad
called an endotoxin that shows up on the tissue, especially mucosal tissue. It can also show up in the lung, which can be very dangerous, which makes it very difficult for breathing. But it also gets overlooked when it comes from the lung area versus the sinus area. And Marcons is usually a culmination of you're having low immunity, you've had chronic illnesses, you've had exposures to mold. That's what proliferates Marcons, but really it's actually the gram-positive, gram-negative Staph aureus bacteria that attracts it. And so sometimes it can't be found when I do the nasal swab because you have too much of that bacteria that's building it, that's covering it. Once I do the treatment and I strip away some of the bacteria, then Marcon can come to the surface. But it's literally like layers and layers and layers of all these things. And I've seen this in children in particular. It's just amazing when I see children that have just been parents reporting they're sick all the time.
Oh yeah.
Is it because they're swapping fomites and they're swapping spit at school? Yes and no. It has to do with their environment. It has to do with their digestion. One of the hallmarks of what I see with the sinus stuff is reflux. So I have a baby that has reflux, they're going to reflux into the sinus cavity. If I have an adult that has reflux, good. They typically will show up with sinus stuff and they don't realize it.
A lot of times with reflux, people don't even know that they have reflux.
Correct.
And so you ask them, oh, do you have reflux? And they're like, no. And then you do all your tests and you're like, you do have reflux.
So it's not about the burning. It's about
Right.
what actually comes up into the sinus cavity. It actually comes up at nighttime. So
Yeah,
going
it's
back to
silent.
the breathing.
Yeah.
And that's what people miss.
Yeah. Yeah.
Which is why I love what you were doing with the whole opening of the airway, explaining it's not just the oral cavity, it's also all the way down the digestive cavity that comes up into the oral cavity, and people miss out of that.
Yeah. And I think my daughter's almost 2 and she's got a lot of friends and they always have the boogers just like in their nose. And I am just like such a stickler when it comes to boogers. In fact, this morning she woke up in her crib and she told me boogie's icky and she was trying to get them out of her nose. And I was like, oh my gosh, you are so funny. You're not even 2 and you're telling me. I was like, do you want me to clear your nose and get those out? And she's like, yeah. But I feel like parents also aren't like taught how to clear out the nose. And so when you just have this chronic infection that's just there and you're not doing, I do some saline with my daughter when she's sick just to clear it all out because I found that it really does help. You know, it helps her get through it and heal faster. And I feel like when you don't do that and parents aren't really taught nasal hygiene with their kids, but it just sits there and it feels like a lot of the stuff that you were talking about is also so linked with the diet, but even the diet of the mom when she was pregnant, the microbiome, all of that stuff comes from your mom and preconception even. If your nutrition isn't great or you're out of alignment or something, that's going to all impact your growing baby. And then once your baby comes into this world, that's where they're starting. They're starting with what came from you. And then you're feeding them a bunch of food that might be causing inflammation. And it's creating that environment that you were talking about, that environment that's not going to be, that's not setting them up so that those things can clear out on their own, right? Because the body wants to heal. I really believe that the body wants to heal, but you have to give it what it needs.
Mm-hmm.
And if we're constantly feeding our kids inflammatory foods and their diet consists of goldfish and white bread, that's not really going to set them up so that they can heal, right? And then you're going to have to take these more aggressive approaches. I love nutrition. It's one of my favorite topics. It's so preventative. I know you love nutrition too, but that's really cool. I didn't know that you did those swabs. I'll be definitely sending you some patients. This is why I send people to Jill, and she's in Issaquah, which is quite a drive. Yeah, it's a drive, but I don't really know anybody else like Jill who's doing this type of treatment that's going to help prevent surgery and really get down to that root cause. A lot of people when they deal, especially with babies and stuff, they're like, I don't want to touch babies. I don't want the liability. They're little baby things. I don't want to treat them. Go see the pediatric doctors who most of them don't know any of this stuff.
No.
Like maybe not any of that stuff that you're talking about. And so it's to have somebody like Jill who can be on your team, who can really get down to that root cause, because it is so hard for parents to watch their kids not be able to breathe.
Oh, yeah.
And I'm getting over like a sinus thing right now. And last week, one night I just could not sleep because I was not able to breathe great through my nose. And I'm like, geez, can you imagine if this was just my normal?
I have my medical bag if you want me to.
Can you swab my nose? I am serious. I have been, it's been hard for me to clear this thing. And normally I clear it really fast. But man, I was just like, geez, like if I was just a kid and this is how I grew up and I just couldn't breathe chronically.
Yeah.
This is horrible. You can't sleep. And all of that, like I had one night of that and it sucked. And I just can't imagine having years and years of that building up. What does that do to your brain? What does that do to your development? What does that do to your life?
Yeah. It sets you back. One of the things that make it a contraindication, I should say, with this particular technique is if they already have overly enlarged adenoids or overly enlarged tonsils. I would see this in some kids where I'm like, oh yeah, you really need to have a surgical intervention. It's not my forte, but I mean, it's not something I go to, but it's like the last endpoint when I feel that there's actually a physical blockage that we cannot fix. And yeah, surgical intervention is warranted, but it's like the last resort. And the reason why kids get to that big enlarged adenoid or tonsil is because of what happened before. They've gone through the gamut with the pediatrician. And again, it's not to give the pediatricians a bad light, but it isn't all about child checks and acute care. Preventative care in childhood development is so crucial, but I don't think that we have had a very good grasp on preventative care from a pediatric dentistry standpoint, from a holistic dentistry standpoint, from a naturopathic standpoint. I think that we have cornered the market on that, trying to teach people, but there's not enough of it. Then most of the parents, their construct with the healthcare system is go see your pediatrician. But your pediatrician, unfortunately, is not going to have all that information. And there are times when I've had providers such as yourself, Rebecca, where go see Jill, and they're like, oh, I need to ask permission from my pediatrician. And then providers are like, but that's not going to get you anywhere. And It's not that we're not giving you the information. The problem is the pediatrician doesn't have the information.
It's just all a lack of education to me. I mean, even with, it's very confusing for parents. And there's also just, I was in another podcast. I mentioned that I got a I get these little things for my daughter, like, hey, you know, she's turning 2 and you should make sure that you do these things. And, you know, it's make sure you're using fluoride toothpaste. That was like number 1. Make sure you're using fluoride in your water. That's number 2. Make sure you take them to the dentist when they're 1 year old and get fluoride varnish put on their teeth. Oh, that's number 3. So those are the 3 things. And then there was like one more, which is like avoid sugary foods. The 3 out of the 4 things are talking about recommending fluoride to babies, which is like completely insane to me because it's neurotoxic and it's toxin for babies and adults, right? But that's the information being given out. And then that same pamphlet, it tells moms to stop giving their kids whole milk, that skim milk is better because whole milk has a lot of fat and that will cause them to have diabetes and be obese. And I am like over here banging my head against the wall. I can't even believe what I'm reading. But this is the information that's given out to parents. And there's just this lack of communication. So then when somebody like you or me comes along and we're like, oh, your kid has cavities, your kid can't breathe, your tonsils and adenoids are huge, they're definitely going to need ortho, all of these things, you need to do bring back the whole milk. Let's get more fat in their diet. Like these really important things, they question us because they're like, but I got this thing in the mail from the state and they're complete opposite.
Yeah.
Right? Our recommendations are literally the opposite of those recommendations. Oh, you need to use a low-fat diet in a 2-year-old because we don't want them to get diabetes. Hello, do you know that diabetes doesn't come from fat? It comes from insulin resistance and your too much sugar and carbohydrates. And it's just, to me, it's fascinating because when I start talking to parents about a lot of the stuff that aren't of the same mind, they think I'm crazy. They think I'm like, how are you feeding your daughter butter? Like she's going to be so unhealthy and obese. And I'm like, no, I believe I'm giving her this butter and it's helping her brain grow because I'm giving her those fat soluble vitamins and all that. But it comes down to that.
Ghee.
Oh, it's ghee. No, it's ghee. I have an amazing video of her she like a quarter cup of ghee in one sitting.
Put it in your coffee.
Yep,
Put it in your
I do that every
smoothie.
morning. Butter coffee is my favorite. And my daughter will just eat ghee by the spoonful. And I don't stop her. I'm like, I don't need to stop you. But it's because there's this misinformation and the information is so opposite of what, like, we don't agree with each other at all. Since, like when parents come see you, they're like, what do you mean I need to do this? And it's just so sad that there is a lack of education. It's just, parents have to drive the show. And if parents are given bad information, then they're not going to go be an advocate for their kid because they honestly don't think that they have to be. Because they're like, I'm doing everything right. And then their child can't breathe and then they need braces and then they need to go see the ENT and have their tonsils out and their adenoids out and all this stuff. And it's also interesting because there is a thought of don't shame food, right? This interesting, that to me is insane. We're not supposed to talk about food being good or bad. We're just supposed to call it food and not restrict. And it's who is supposed to teach kids then how to eat healthy but the parents don't even know because they're not given the right information. So I feel you. I went on a bit of a tangent here, but I'm passionate about it because it is so lack of education and the pediatricians are doing their best and the naturopaths are going through their programs and they're doing their best. And we're all just not, nobody's really fully agreeing with each other. And so it leaves parents like spinning off or really questioning your recommendations, right?
It's interesting. I'll get a lot of those parents that come in and they'll say, pediatrician says X, Y, and Z. And I said, okay, here's my reasoning behind it. And I walk them through it. And one thing that I'm very passionate about is education and the time that I spend. And giving them that education is so crucial to take that 5 minutes, that 10 minutes, if you need to explain all that, especially if it's a first-time parent, because they're just inundated with everything. They're getting it from their grandparent, they're getting it from their friend, and they're just like, so what do I do? What's left? There's no book out there that's going to tell them, okay, start with this, then do this. What I've been trying to do is just really hone in my focus a little bit more about the nervous system. I say, okay, we need the nervous system like we need the electrical panel in the house. You need to be able to have things working, electricity working, running things. The brain needs that. So the only way that I feel if I can get my message out there is really teach people what is balance? What is balance for you? Does it mean you don't have a headache for a week? Does it mean you're not getting a stomach ache? Does it mean you don't have neck and back pain? What is causing all that? Then I go back to the underbelly, and it's called emotion. People tend to think it's just physical. Most of the stuff that we experience is atraumatic. And the fact that it's atraumatic, we are left with, okay, let's just go see a psychologist. Psychologists helped with the vocalization and processing. But really what we're doing is unwinding all of the toxins and the things that have impacted our environment that makes us not being able to focus, that makes us brain fog, that makes us feeling uncomfortable in our body. It goes back to resetting that feeling from the time of birth. And that's the whole premise of why I do this technique. It's extraordinary in that sense to watch people go, wow, that hurt for seconds. And I feel different. I feel clear. I can breathe better. That's my first step. My hardest cases, believe it or not, are the tinnitus. Tinnitus is a really sensitive thing. And tinnitus comes on because it could be nerve damage. It can be so much inflammation that we actually have to treat somewhere else, like the gut. And then really looking at the emotional contracts. I love it when I get to all that. How's your life? And then all of a sudden, the water won't come. And they're like, since the pandemic, it's been hell. And it's been hell for a lot of people. The max mandate, I have some multiple chemical sensitivity patients. They're like, I wish people would still wear the mask. And in the back of my mind, I'm like, we're missing our microbiomes. I get it. I get you're really struggling. But those of us that wear the masks that don't have the multiple chemical sensitivity, we're losing our microbiome.
Mm-hmm.
And people are questioning, should I wear the mask? Should I not wear the mask? The mask was detriment in a lot of different ways. It helps, it prevented, but it also hurts. And what we learned from research is washing your hands and not touching your face was actually the best outcome.
Yeah.
Not so much the mask. Again, that goes back to how are we treating the microbiome? If we're missing it up in the airway, we're missing it everywhere else.
Yeah.
I have a question, Jill. So is this one of the things that's very popular these days are the nose strips?
Yes.
So I see these all over the place. So if a person's been wearing nose strips or that's something that they're into, is this a treatment that would be beneficial for them? Or is this something they should look at, right? It could maybe replace the strips.
Yes.
Yeah.
Because the strips are so stupid.
They're literally a Band-Aid.
Yes.
But it's good. It's good to know, if the strips helps, then it can be diagnostic, right? And same with the cones. It can be like, and with my rhinometry, I can see where the constriction is. So I can be like, the cone's probably going to work better for you, or ma'am, try the strip. So yeah, but the whole thing is like, we obviously are struggling to breathe through our nose. That's why the strips are so popular, and there's the cones, and mouth tape is such a big thing. Like all of those things are really coming out there. That's why people snore. It's all airway health. All of it is airway health. And I love what you said about the tonsils and the adenoids, because I also don't love the idea of taking tonsils and adenoids out. However, if you have a child who has gigantic tonsils and they are blocking the airway and they are cryptic, they are not functioning anymore.
No.
They're not working. They are scar tissue. So get the scar tissue out of there so that your kid can breathe, because it's so important that a child, when they're growing and developing, their brain is growing and developing. And if you do not get oxygen and get the CO2 and the oxygen balance right, you are setting them up for their brain not to grow properly. And that is huge. And you have a window. And I hear this all the time from ENTs and pediatricians. Oh, they'll outgrow the tonsils. They'll grow out of that. No way. Are you kidding me? Like, your kid is sucking through a cocktail straw day and night. Their brain is not going to be able to grow. No. You don't want to wait until they're 10 or 11 or 12 to take those tonsils out. And you don't want to see if they grow out of them. You want to get those out if you know that they're not working and they are blocking the airway.
Yeah.
And I have a lot of patients that are holistic, and they really are like, I don't know if I want to take them out. I want to be aggressive. And I got an opinion from the pediatrician, and they think that you're being too aggressive. And I understand that you don't want your kid to go through that. I understand that it's traumatic and there's a surgery and there's recovery time and it's your baby and everything. But you have to think about their brain growth and long-term health here.
Yeah.
Because creating a healthy airway, you have to start at birth. You really have to start it. And the earlier that you start and that preventative thing, the earlier you can get that airway open and make sure that things are healthy, the better long-term success they're going to have with their health. The airway is our lifeline. It's our lifeline. It's one of the most important things. Don't just sit around and watch and wait to see if it gets better. That's insane.
That's based model.
I know. That's insane to me.
The system is very disease-based. It's not preventative. And people see it's not money-making. And I'm like, okay, I understand that it's not money-making according to them, but it's life-changing when it's balanced. When I look at Europe, when I look at a lot of the places that I've traveled all over the world, they actually practice more prevention than we do in this country. It's like healthcare is taking a backseat. And then you have this small population between 5 and 20% that are so committed to the best outcome of their healthcare. But majority of the country is left with, the doctor said it's fine.
Yeah.
That's my least favorite. When I get a patient that comes in and they say, I have all these labs. Just what's wrong with me? And I'm like, do you understand your lab? So it goes back to education. The more they're educated, the more they'll find balance. If they don't understand their body, they're not going to be compliant in anything. It has to be, they need to know why it's important. If I get a patient from another provider that says, I'm taking this supplement, and I'll ask why. Do you know why you're taking this supplement? That's important in finding balance. So that's one of the hallmarks that I get back to when I do the neurocranial restructuring. What is the outcome do you want to have? Because you need to be committed to this. Typically, the first treatments are about 4 treatments in a row. And the idea behind that has to do with headache, tinnitus, that kind of thing. But the more extensive treatments are, I can't breathe, I have jaw problems, I have ringing in the ear that's constant, I have vertigo, I have night terrors, I have ADHD. These are the kind of things that actually can be helped with neurocranial restructuring.
And sorry. So Jill, and you're like, we talked about getting punched in the face, and obviously that was just my experience. I know some people love the feeling. I wasn't a fan, but
frequent flyers.
Yeah, I bet you do have frequent flyers. I have patients that are like, I can't wait till next Tuesday. I get my adjustment, and it's like this. They really honestly look forward to it because it makes them feel so much better. But your treatment is not just doing this adjustment, right? Like when
Correct.
Somebody comes to see you, if like a mom brings their child, or if a patient has tinnitus, they come to see you, you're gonna do like blood work, you're gonna do your full intake, and you're gonna use supplements, you're gonna use maybe some cranial or some adjustments, and you're gonna do like the whole thing, right? And you may find, hey, this balloon technique up the nose, this could be helpful for you.
Yes.
Because right? But you're not just like pumping them in and out, just doing this balloon all day long, right? It's much more comprehensive than that.
Yes.
Yeah.
Yes. It's much more extensive. So usually when patients come in, I get a full history intake. So the first visit, it's about 45 minutes. And I go all the way back to childhood. So even if it's an adult, I go back to childhood. If it's a child, I go back to birth. And so it's important for the parent to be there so that I can find out how was the birth process, what happened in development. As the development occurs, then I'll hear things like, oh, there was a problem at birth, or there was a birth trauma. And then I see how it progressed in the first year of life. Excuse me, when I look at the first year of life, this is where I start to look at primitive reflexes. If they are retained, meaning they have not grown out of them, the primitive reflexes that are retained can create more problems. For example, the biggest one we have now is ADHD. And it's overlooked in many ways, but providers aren't thinking about primitive reflex. So some of the primitive reflex are moral. Some people will remember them. So there's moral, there's atonic, labyrinth, there's systemic labyrinth, how to cross the body. There's Palmer's, how to write. Those kids will have behavioral discrepancy if they are retained. And so I add that in, looking at functionality, looking at digestive, looking at airway. All of that plays in the role in order for them to get better, including learning how to integrate those reflexes. So it's not just, you're right, it's not just, okay, we're going to go up the nose and do that. It's just one of many processes to get there.
Yeah, I love your I just love how comprehensive you are. Yeah. I think that there is so many naturopaths that see kids or whatever, but you take the emotional component, you take the trauma component, you go all the way back to birth. It's such a comprehensive model. And I feel like our kids really need that because, again, that prevention starts there. And it just doesn't feel like there's that many people that are really taking it to that level of comprehensive care.
Yeah, I was thinking just selfishly, like many times on our podcast when we have someone on, I know Dr. T does this too, we start thinking about our own kids a lot or ourselves, but I was thinking about my daughter. I was like, I'm going to make an appointment for my daughter to come see you because she's a teenager and, I just think it has a number of different hard to pin down health issues. And when I hear something like this approach and the comprehensiveness of it and looking at it from a lot of different angles, that's immediately I was like, this is you're the person I think that she should go see, because so often my experience has been people are just looking at it through one lens. Even great naturopathic doctors might still begin looking at it from a blood work, maybe looking at it from a food allergy standpoint, might be looking at it from that kind of specific frame, but not looking at it from multiple different frames and different angles. And so that's really unique approach that you have.
That's why Jill and I get along. We get along well. Because we're both like, ooh, what about this angle? What about this angle?
Well, we'll be texting, she'll tell me a new technique, and I'm like, oh, I want to come and see that.
Yeah.
Oh, well, I'm working on it. Okay. And then same thing here. I feel like people need that comprehensiveness. People need to be able to take a look at the whole picture. Even, I get teased when I say to people, I check my phone every morning if it's going to be a difficult day or a good day. And what I say by that is the atmospheric pressure. So if I have babies all day, I'm like, oh, this is going to be a crying day. Mom's going to come in going, why is my kid screaming? We have an atmospheric pressure issue. And then I show moms, this is how you have to maneuver. Think about steam inhalation. Think about essential oils. How to open the brain up when they're in that atmospheric pressure dip. So just something as simple as that, teaching parents, look at your app, check and see. This could be a hard day. This could be a good day.
You just walk into your office and there's just so many diffusers going on. It's just like, it's Tuesday, so we're going with orange today. I'm just going to hit a wall of orange when you come into my office.
Yeah.
That is so funny.
So funny.
So Jill, you work with like little babies and you also work with adults.
Yes.
And what do you do for a kid that has thumb sucking?
Kid with thumb sucking, give me an age.
Let's say 3-4-year-olds.
Okay.
Just sucking their thumb. I feel like, you can correct me if I'm wrong, but I feel like some thumb sucking in the beginning is very self-soothing. And to me, as a dentist, I don't care. I'm like, it's fine. Yeah. It's the kids that go around with their thumb just chronically in their mouth, to me, that are those ones I'm like, ooh, something's off here. And I feel like, is that an emotional thing, or what is your take on tongue ties and
so
like that?
So think about the vagus nerve.
Or not tongue ties, sorry. Thumb sucking.
You know that if it's self-soothing, the first place we're going to go is the vagus nerve. So consciously or subconsciously, we're going to go somewhere in our mouth to calm down. If that's the case, then I start looking from a dentistry standpoint, the craniofacial bones, what's happening with sphenoid. Is there a compression issue? And what I mean compression issue, it has to do with the occiput or the sphenoid, the front bone, right at the sphenobasal junction. Then I know there is a hormonal issue there's an emotional issue, there's a digestive issue. When I see the chronic thumb suckers, I find a lot of digestive issues going on. They're my picky eaters. Now, this is before I even go into the mouth and figure out, okay, there's a tongue and lip tie issue. And people say, oh, everybody has a tongue and lip tie. I'm like, no, there's a whole fascia component that comes with it. It's not just the facial. I'll start looking further down the body. I'll look at their gait. A lot of my thumb suckers walk offshoot. So again, that's the proprioception balance issue that happened. So when I start seeing that, I'm going to start addressing the proprioception first. And then I will go down the rabbit hole of digestion. Does your child feel safe? Is there something in the environment that's affecting the child? There could be something as severe mode and parents don't even know it. And they're unwinding because that's all they know. But the vagus nerve is the one that helps us figure out how to be grounded. So it isn't always just a structural component. It can also be an emotional component.
So when would you say, if there's a parent listening to this and their child is sucking their thumb, like when would you say, okay, this needs to be investigated further? This is abnormal. What age? What? I have patients ask me this all the time, and I have my answer, but I want to hear yours.
This is something that's near and dear to my heart when I see kids, even older than 3 and 4, and they have a binky, a blankie, I'm sorry, not a binky, a blankie, and they're sucking their thumb. And it's funny, there's a couple of parents I've seen where they actually put the Apple tag on it. So if they lose it, they beep it and they go find it.
Yeah.
Which, that's their livelihood.
Yeah.
They have to have it. But when I see that, then I know there's digestive component, and I'm going to start there. I'm going to start easy and then work my way in and figure out what else is going. Sometimes there's a constipation issue because they can't relax. So they have to suck their thumb to be able to relax, to poop. I will see that a lot. So if you start to see a kid that you're seeing that is not wanting to take their thumb away, I usually say because there are other issues going on digestively, or they have anxiety issues, which also plays in a role. And this is where, again, I know this is a lot of information, but this is where we have to retain primitive reflexes. And that's what I really start with. But I try to do the less scary thing first. We do the digestion, we do the balance, and then we go further.
So do you think that any type of thumb sucking is normal?
No.
No. Okay.
No.
So any time that there's thumb sucking, whether it's in a 6-month-old baby or a 2-year-old or a 4-year-old or a 5-year-old.
A 6-month-old baby, they're getting comfortable with oral fixation in their mouth. Their lower esophageal sphincter has come down. They're just learning food. They're putting their hands in their mouth. Not first year to 2 years, I don't get on that. But after 2 years, that's when I'm like, there's something going on.
That's what I tell patients. That's what I tell patients too, unless it's chronically in their mouth. I mean, my daughter, like, she's not really a thumb sucker like during the day, but when she goes to bed, she'll suck her thumb for a few minutes and then she spits it out and she sleeps the whole night with her thumb. So
fine.
To me, I'm like, that's probably fine. I'm going to keep an eye on it, but that's probably fine. If you look online about thumb sucking, it's like evil, bad. And I do believe, like you said, that babies have this need to suck. It's exploratory and it's a way to self-soothe. And so I feel like we shouldn't demonize it too much. But then there is that when it becomes, when it's out of the normal and it becomes a bigger problem, right? That might say there's something else going on.
My daughter was that blankie thing. My daughter sucked her thumb until she was, I don't know, like 8 or 9.
Yeah. Oh, wow.
Could not get her to stop. In the blank, it was.
Did you have an air tag?
They didn't exist then, but if I had, I would have. I had a backup blanket I kept in the closet in case her blanket got forgotten at home.
Oh yeah, smart.
I would have to drive all the way to her mom's house 30 minutes away to go get the blanket. So I had a backup spare blanket, but she sucked her thumb for a long time. And no one that we talked to, though, ever brought up any of this stuff, right? And so I, as a parent, literally had no idea what to do about it or how to approach it or stop it. And like, I was like, I don't know what to do. I can't make her stop. I physically cannot make her stop doing it.
Yeah.
Like, I don't know why. All the stuff you're talking about, like, it makes so much sense. She still has gut issues now and other things. So this is what I think we oftentimes talk about, a lack of education. And you mentioned earlier, there's not a book. Maybe you should write the book.
Yeah.
I think
Jill,
you need
we
to
should write a book.
You guys should partner up,
we
because
should.
you get super pumped about this too.
I do.
Yeah.
You get very fired up.
I do.
Hardcore about it.
I
And
do.
like, I feel like every time we're on the show, it eventually comes back to this topic.
Yeah.
I feel like just this information is just, it's just, everybody needs to know.
For 100%, they need to know. Yeah.
Yeah.
I mean, this was, we started off talking about nasal breathing and that whole piece, but I mean, we went so much deeper and so much further.
But it's all linked.
It's all linked.
That's the thing, is that when you're thumb sucking, your thumb is pushing up on the palate. That changes the hard tissue. And so
Yeah.
it becomes harder to breathe through the nose because the palate collapses. And so then you have teeth that come in crooked, and then you can't breathe through your nose. And then the sphenoid and all of the cranial bones are off because there's, and it is all the same. And that's I think what's just fascinating about this whole topic of mouth breathing and nasal breathing and growth and development is that, I mean, we talked about the tonsils, we talked about the adenoids. Those are all linked to the airway. We talked about thumb sucking. That's linked to the airway. And then that's linked to like vagal nerve and the cranial bones and all of that. And so it's hard to talk about just one thing because it's just so intertwined and connected. And there's really no resource that really breaks that down and really talks about it from that comprehensive place.
I feel like this is a topic that most people know absolutely nothing about. They don't think about airway that often. They're not thinking about the cranial stuff. They're not thinking about interconnectedness.
Even naturopaths, and even amazing naturopaths.
Yeah.
Like my stepson has ADHD, and I met him when he was 4, and I did an airway analysis. I did CT, and I said, oh my gosh, this kid, his sinuses were completely full. Like you couldn't see anything. They were completely full. Mouth is always open, mouth breathing, snoring, all of that. And he came to see me, and I said, you have to go see the ENT. Like he can't breathe, the tonsils, the adenoids, and this was many years ago. I'm like, you got to go see the ENT. So the ENT looked at him and he's, oh, you got to take those out. Those tonsils and adenoids got to come out. And so I told his dad, who's now my husband, and his mom, who's, my husband's ex. And I'm like, hey, like you need to go do the ENT and do this. And I can do the dental stuff. I can expand, I can widen, I can make room for the teeth. I can do my preventative thing dentally. But unless we deal with the breathing issue, I'm just not going to be able to fully help him because everything will relapse. If we don't fix the breathing and fix the function, everything will relapse. And so they ended up not doing the tonsil and adenoid surgery because they didn't want to, because it was, again, that this is my baby. Does he really need it? The pediatrician says it's fine, like blah, blah, blah. And so now he's 10. He's been through 2 expanders, and he just came in last week. Still doesn't have enough room for his teeth after 2 rounds of expansion because he's relapsed because his mouth is always open. He's breathing through his mouth. His tongue is not up. And so now I have the rhinometer and the pharyngometer, and I did that on him. And I could see that his airway was half the size as it should be where the tonsils are. And I'm like, do you see this? And then his nose was completely not functional. And I'm like, do you see this? This is where it should be. This is where he is. And so maybe finally I've gotten through to my husband, Patrick, and maybe his ex, that they need to go treat this kid. But through all of that, he had ADHD. And we went to naturopaths, functional medicine doctors. We even went to the Amen clinic. And on his medical history form, I was always like, put the de-snores, put the airway stuff, because I know how important it is for ADHD. But they didn't even ask questions about it.
Yeah.
Not concerned about the sleep part, not concerned about the snoring, not concerned about the tonsils that are enlarged that the ENT said you should take out. They did not care. They just were like, here's a bunch of supplements and let's follow up. And his ADHD symptoms got a little bit better, but they're not gone. He still has it. And so now, again, you've got this kid who's going through school and he's struggling, he's trying to get good grades. And what would have happened if we would have just treated his airway when he came to see me when he was 4 years old. What if we would have gotten those tonsils out and those adenoids? I would have expanded him, not had to do a second round because he wouldn't have relapsed, gotten his mouth closed, got him breathing better. Would he have the ADHD still? And to me, that's a big question mark because I'm like, I don't believe he would. It's impossible to go back and tell, but it's like those types of things, the airway is just so fundamental to our health.
Yes.
And it's linked to almost everything that you could possibly have symptom-wise.
And that's what you were saying. If you go backwards and you look, but where we're looking from is what would have been had we had done it this way. But this is what we're trying to undo to prevent people from doing that.
Yeah.
And I do feel, based on just my years of clinical experience and watching the trend, that had it been addressed earlier on, that's why I'm so committed to addressing babies so that as they get older, they won't have those problems. And even if they do have those problems, I have my eyeball on it.
Yeah.
And then I can say, okay, this is what we're doing. Right now in my clinic, I'm creating what we call the sensory room because I am inundated and frustrated with our educational system. I get our teachers are maxed out, but our educational system with our kids, when we're trying to do the 504 and the IEP, we're letting them slip through the cracks. We're not even paying attention to primitive reflex. Then they get shipped off to OT, vision therapy, physical therapy to address all this. And I'm like, but they're seeing like that little tiny viewfinder of it. They're not looking at the whole picture. And I'm like racing against time, literally trying to get as much as I can, the message out there. Because all of us, our lives are finite. So I want us to be able to see a change in our healthcare system. And we're not seeing that. I thought, let's create a community sensory program. And that's what I'm doing right now.
That's so cool.
Jill, so cool. And so many amazing things that we covered today. And thank you so much for sharing your passion and your insight and your ideas and your really incredible work that you're doing at your clinic. Just gave me a lot of great things to think about. And of course, Becca, thanks as always for getting pumped up about these things and getting just totally fired up. So if somebody wants to follow along with you, what's the best thing, or come see you? Your clinic is in Issaquah.
Yeah.
Are you online, on social, or any of that kind of stuff?
I just had an amazing web designer just revamp my website, so it's going to come back online this week. The best way to get in touch with me is my office texting system, which is 425-600-3133.
Great.
Yeah.
Excellent. And again, you see from babies all the way up through to adults.
Yeah.
You're there to help.
Absolutely.
Thank you
both so much for having me. This has been such a joy, and Ari, it's wonderful working and talking with Rebecca Taylor.
We got to do more
She's
collaboration.
extraordinary.
We got to do more collaboration. I think that's what I got from this podcast.
I think the course
We
or
need
a
to-
book.
We need to partner up, Jill, because we got some good information to get out there. So,
Yeah.
I agree. Here. Let's do it.
amen.
Okay. Thank you. Thanks for being here. Until next time, friends, remember your mouth, your nose, your airway, it all matters. And if you have an issue or problem, we're here to provide you with tools and solutions. We'll catch you on the next episode.